Hi, I'm Dr. Desai.
And I'm Dr. Joyce Akwe.
So great to be here with you, Dr. Akwe. Today we are going to talk about cervical cancer, as January is Cervical Cancer Awareness Month, Dr. Akwe. Thanks for being here. Can you tell us what is cervical cancer?
So cervical cancer is actually cancer of the initial part of your uterus. So you have the vagina and then you have the uterus, and that initial part of it is called the cervix, and cancer in that area is known as cervical cancer.
Got it. So women's health is really important. Cervical cancer is a big cause of cervical cancer or cancer in this population. Can you tell us when we should start screening and looking for cervical cancer? Are all ages affected? When should we really start thinking that the ladies need to start getting screened?
So cervical cancer, again, has some risk factors that could depend on the lifestyle. And once somebody becomes sexually active, then they are at the risk of cervical cancer. So people above 18 years old who are active are at the risk of cervical cancer. But the CDC recommends screening to start at the age of 21. So between the ages of 21 to 30, we should start screening for cervical cancer. There are two types of things that we look for when we're screening for cervical cancer. We're looking for HPV virus, what is also known as a human papilloma virus. This is a virus that can change the cells in the cervix to become cancerous cells and becomes cancer. So this is an infection that can be prevented, and which, if not prevented or not found earlier, can become cancer. The other is the pap smear. The pap smear actually looks for cells that are beginning to change their form to become cancer cells. So when we are doing a pap smear, what we look for is cells that are changing, and these cells may not be cancer yet, but they have a tendency to become cancer. And so once we have this type of changes in the cells, we have different recommendations based on how advanced those changes are. For the HPV viruses, once you have an infection, those can be treated. So I'm very happy to say that cervical cancer is one of the cancers which can totally be prevented if we have our screening as we should do. Whereas most of the other cancers, usually the screening is to find them early and then treat them. Cervical cancer screening will help you find them early and will also help you prevent cervical cancers.
Well said. Thank you. One thing I do want to go back to, HPV, human papilloma virus. So you talked about that being a risk factor.
Correct.
So just because you have HPV, does that mean you will get cervical cancer?
Absolutely not.
Okay.
HPV can transform cells into cervical cancer, and it's not every type of HPV. Several different types of HPV exist, and some of them will cause that transformation, some of them will not cause that transformation. The most important thing for us to know is that if you have an HPV infection, you want it to be found early and treated. And I said earlier that we can screen between 21 to 29 years every 3 years, but as you grow older, you also have to continue screening, and that will depend on a lot of different things. So if you're between 30 years and 69 years, you need to talk with your medical team, and they will, based on your lifestyle, based on your history, they will ask you some questions, and they will determine if you need just the HPV screening, if you need just the pap smear, or if you need both of them. And the frequency with which those are done will be determined, and your medical team will be able to give you that information.
That's great advice. I think it's really important that we talk about. We oftentimes don't talk about enough about all of these different cancers that can affect the reproductive tract in our females. I'm a father of a daughter. I'm also married. What can we tell the young ladies who may feel scared about going to get a pap smear and starting that whole process? Is it, without getting too personal, a lot of people may be scared about the pain, the discomfort, being embarrassed by it. Can you share any pearls that we can share with our audience?
Well, these screenings are done by experts. They're done by people who've trained to do these screenings. And I will just describe it in a very simple way. They use an instrument which could be, at times, is made of plastic or of metal, just to open and look in that particular area, and they're specifically looking for those cells which look different. And they will take some cells, it's just a rub, so it shouldn't really be painful. take cells from that area where they can then go and again look at those cells detailedly to see if they have the infection or if there are changes in the form of those cells. So once you have that test done, you get the results usually like within 3 weeks. And again, depending on the findings, they will determine what to do next. It's not a test that is infrequent. Most of the physicians who perform that type of test are very used to performing those tests. And so you shouldn't be embarrassed about it. The people doing it have done it so frequently, so often, so it's something which is becoming almost second nature to most of the providers that perform pap smears.
That's well said. That's well said. I think we need to hear that because going to the doctor for a lot of us is not fun. And having these sort of tests that feel very invasive and personal, they also make us feel vulnerable. But cervical cancer is very important to talk about, and January is Cervical Cancer Awareness Month. And thank you, Dr. Akwe, for coming to talk about that today.